Broadcasting live in Micawai National High School. Live above and beyond, leading the way. This is NTC, and variety is the spice of our station.
Good day, Luzon, Visayas, and Mindanao. Our mission is to inform. Our delights is our concern. I'm Jayan Isabel E.
And this is Ariel Tuban, your trusted NPC uncle. Always reminding you that variety is the spice of our station. Focus your eyes on the screen, hold your breath, because this is our headlines for today.
COVID-19 latest updates as of November.
Updated health protocols released by the IATF.
Health and safety reminders regarding COVID-19. For the COVID-19's update worldwide, here are the numbers of the new cases reported today. Let's listen to our news correspondent, Arus Santa Rosa. Arus?
Thank you, Jay. As of November 2, 2021, authorities in 223 countries and territories have reported about 429,800 new coronavirus cases, totaling around 248,405,238 cases around the world. 18,300,281 here are active cases. 99.6% are in mild condition and 0.4% are in serious or critical condition. But the coronavirus have claimed more than 5 million lives. COVID-19 remains a leading cause of death around the world. The United States has the highest official toll with more than 700,000 recorded deaths. And Brazil also has been dealt with a heavy blow, losing more than 600,000 lives. On the other hand, 7,486 cases have been reported today.
Arus, are there latest discoveries about the coronavirus?
Yes, there's newly discovered mutation of the Delta variant is being investigated in the UK, amid worries that it could make the virus even more transmissible and undermine COVID-19 vaccines further. Still, there are many unknowns surrounding this descendant or subtype of the Delta variant, formerly known as AY4.2, which some are dubbing the new Delta Plus variant. UK government officials have said it's too early to tell whether the mutation poses a greater risk to public health than the Delta variant, which itself is significantly more infectious than the original COVID-19 strain and its successor, the Alpha variant. But they have stated that they are monitoring the mutation very closely. It does now account for 6% of UK COVID cases that have been genetically sequenced at a time, when infections in the country are rising rapidly. This is your news correspondent, Arus Santa Rosa, serving the nation.
Moving on to COVID-19 updates in our country. Let's listen again to Arus Santa Rosa. Arus?
Our country now has 2,792 cases and 656 COVID-19 cases after the Department of Health, DOH, reported 2,303 new cases on Tuesday, November 2. The DOH also reported 128 new deaths, bringing the death toll to 43,404. Meanwhile, the recoveries were up by 4,077, raising total recoveries to 2,708,466. Of the total cases, 40,786 or 1.5% are active. This is the lowest number of the active cases since at the said time.
Is that so, Arus? So, do you have any updates on how our vaccination is going?
8 months after the Philippines rolled out its COVID-19 vaccination program, first among health workers, the government will start inoculating minors aged 12 to 17 against the deadly virus beginning Wednesday, November 3. Health Undersecretary Mirna Kabutay said, due to a stable supply of COVID-19 vaccines, the government decided to do nationwide rollout of pediatric vaccination instead of implementation by phases. Before this, the government was planning to do the pediatric vaccinations in regions where the inoculation coverage of the A2 sector or senior citizens had reached 50%. The health official said the move to hasten the vaccination for minors was due to the planned gradual reopening of schools for limited face-to-face classes. Citing the data from the Philippine Statistics Authority, the Department of Health, DOH, said that there are around 12.7 million minors aged 12 to 17 eligible for the pediatric vaccination. Kabutay also said that DOH is targeting to vaccinate 80% of the target pediatric population by December 2021. Before the nationwide rollout on November 3, a number of areas in the Philippines have started vaccinating their minors with comorbidities in a pilot run, Again, this is Arus Santa Rosa reporting.
Moving on, the world is deeply affected by the COVID-19 pandemic. Positive cases are rising and the number of deaths of everyone is at risk. That's why the IATF released a health protocol. Let's call on Pink Floyd Takasa for further information regarding this issue.
In this time of pandemic, safety of everyone is our main priority. Because of that, the COVID-19 Interagency Task Force for the Management of Emerging Infectious Diseases Resolutions or IATF released health protocols for us to have our limitations and be mindful of what we do for our own safety and of course for other people's sake too. This includes wearing a face mask and face shield when going outside. It will surely protect us from catching the virus. Also, before entering any establishments, someone must check your temperature. Having a fever is one of the symptoms of COVID-19. And that is why only people who have normal temperature can enter for the safety of everyone. When we go outside, we're exposed to a lot of things, and one of them must be the virus. That is why you should always disinfect with use of alcohol or hand sanitizer. The next precautionary measure is social distancing. We should distance ourselves with people 6 inches to avoid infecting each other. Another precautionary measure that the government implemented is not allowing a group of people to come out of their houses, including Filipinos who are already unhealthy because of vulnerability to be infected. Suppose the age group of the Filipinos that may go to work and buy the essentials for their family is described by the inequality. Don't worry, everything will be clear once we start to solve it. First, let's turn the inequality into an equation for us to be able to solve it. Second step is to find the roots by use of factoring method. Now we have our roots 14 and 66. For the third step, let's start to plot the points, since the inequality sign is just less than. We'll put hollow circle on 14 and 66. Next step is to test. What part is shaded? What set of age are allowed to live in their home? Let's find out. We just need to choose 3 numbers in each of the 3 parts. Our choices are 10, 20, and 70. Since only one appeared to be true, let's now shade the middle part. And now, we have our answer. As shown in the graph, our government only allowed people with the age of 15, 65 to go outside.
Thank you so much, Pink. What you just showed was such a creative way to explain a very important information to us. But I have a question. What should we say to those people who want to go out but do not belong to this set of ages?
A very interesting question we have there. Why don't we ask for people's opinion?
I will inform them of what danger awaits them when they go outside. I know that we have been locked in our home for so long, but this is for everyone's safety. Staying at home is the least we can do to help our frontliners with the fight against our unseen enemy. Who are we to not do that, right? So let's just follow this protocol so that someday we can go outside again without any glint of worry.
For health and safety reminders regarding COVID-19, let's hear Rick Joshua Roy.
COVID-19 is largely transmitted from person to person. It is our shared responsibility to combat this sickness. You can protect yourself and others by making these health and safety reminders. Face masks and face shield are required when entering public places. Also, COVID-19 can spread poorly ventilated and or crowded places. Poorly ventilated indoors location, keeping physical distance and avoiding prolonged contact with others. Spraying disinfectant even outdoors can be noxious for people's health and cause eye, respiratory, or skin irritation or damage. People may become infected by touching their eyes, nose, or mouth without cleaning their hands.
Thank you for informing us on what we should do to keep us safe. But people can't always be perfect, right? They might get infected without them knowing. So, my question is, what are the symptoms that show a sign that someone like one of our family members get infected by COVID-19?
Most common symptoms are fever, cough, loss of smell, and taste. Other people show serious symptoms like difficulty of breathing and shortness of breath. Seek immediately medical attention if you show serious symptoms. If one of your family members shows symptoms of COVID-19, quarantine her or him for 14 days. Keep distance from infected, spray disinfectant, surface that show has been infected, and limit or avoid contact as much as possible. This is Rick Joshua Roy of NTC reporting.
Thank you, Rick Joshua Roy.
This is Sarah Joy Tupan expressing our gratitude and bidding goodbye. Once again,
Live above and beyond.
leading the way.
In the variety despite of our station. Have a good day.